to just see our practice around curriculum review, development of curriculums, reviews, implementation, and evaluation. So it's the status, rather what we are doing at our schools, and majorly at the School of Nursing and the School of Medicine. So we were having this conversation with Dr. Awuor because he's the chairman for curriculum review at the School of Medicine, and I'm sitting in that position at the School of Nursing. So we just wanted to share with you some of the challenges that we encounter and the progress in terms of curriculum, development, review, and implementation at the two schools. So yeah, in terms of the outline of my presentation, so my presentation is about the current situation of the curriculum processes in the two schools, and some insight on curriculum development and review at the school, and then the challenges, and then the way forward for future curriculum reviews at the schools of health sciences. So currently at the two schools, that's at the School of Nursing and at the School of Medicine. So my focus of the presentation is majorly on the undergraduate programs. So for the School of Nursing, we are at our second curriculum following a completion of a cycle, and the School of Medicine is also in their second curriculum for the MBCHB students. So the first review for the MBCHB curriculum was done in 2018, and they are in the process of implementing the next one. In the initiation of curriculum review, usually it's initiated at the departmental level. So there are, like in the School of Medicine, we have courses which are particularly domesticated in the departments. So usually the chair of the department would then initiate this conversation with the dean of the school, so that maybe at the end of a curriculum cycle, or when a training needs assessment has been conducted, so that that would call for maybe a new curriculum, or for a review of an existing program's curriculum. So through the school board, the dean then mandates the curriculum review committee to partake in either review or development of a new course. So we do reviews when the cycles are over, and we do development when a needs assessment has indicated that we need a new course at the schools. So following the school board meeting, the curriculum review committee would then reach the departments and engage them, and also arrange for the stakeholders meeting. So at this point, the stakeholders meeting will be conducted. And then the feedback from the school, from the departments and from the school and from the stakeholders meeting will then be, the feedback will be consolidated and shared at the school board. So usually when the school board meets, some of the considerations that are put forward are, for example, changes in trends of technology. So I'm saying maybe the focus areas that the stakeholders look at, as well as the schools, are trends in technology and trends in market and regulatory bodies, and also customer feedback about the performance of the curriculum. And then finally, the committee considers the feedback and reviews the content, and the content is ready to move along the other processes. We were excited about this conversation because we wanted to see, because we've been taught so much about the curriculum in the morning from the process of development, review process, and what about the performance of our current curriculums? So usually you find that on the performance of a curriculum, it's important to get feedback on curriculum implementation. And the departments and the schools have to get, let me say, like platforms where the feedback is shared so that they can improve when the next curriculum cycle is due. So we wanted us to see, for example, at the schools or any other schools that may have attended here, how do we get the student feedback on our curriculum implementation? What about the faculty engagement or the faculty feedback? And the markets and alumni feedback, and then the feedback from the regulators. And we know at the schools of nursing and the schools of medicine and related schools, we have the licensure bodies For example, we have the councils that regulate the training of nurses, the doctors, and the lab staff. So at the School of Nursing and Medicine, currently we have feedback on, especially the performance of the curriculum from the student's perspective. So on the student's perspective, we have some insights that was shared by Quality Assurance about the performance of the curriculum. So we got some feedback from the last year, the university conducted an exit survey from the students to try to assess what they thought about our curriculums and teaching and curriculum evaluation at our schools. So I'd like to share with you the feedback on this. For example, the graduating class undertook a survey on the 15th of December, whose response rate was about 83.9%. So this was only for not only for the School of Medicine, but all the other students who are graduating, and not only in the undergraduate program, but also in the postgraduate program. So they used a survey tool that was shared online and was active for around 10 days, and the graduates had time to fill in the survey tool and to respond to the questions that were sorted. So the respondent rate was around 84.6%. where it considered 247 graduates, and that is from undergraduate category. So we were interested to share the recommendations by the students, especially on the improvement of quality of teaching, learning and research, and the general learning environment. So from the feedback that was received from the students, especially, and this pertains to the School of Nursing and the School of Medicine, most of the feedback, like you can see from this feedback, most of them are resource-based. For example, they're talking about the quality of the laboratories. They're talking about upgrading the computer infrastructure. They're talking about increasing the number of lecture halls, increasing the physical resources, providing teaching and learning materials which are adequate, including things like textbooks, whiteboards, pens, marker pens, and the like. And in other feedback also that was extracted from this report, improving the learning infrastructure and teaching, particularly of Jaramogi Oginga Odinga Teaching and Referral Hospital, was the main feedback that came from the schools of medicine and nursing. And I think this brings us back to the presentation that was made by Professor Ali, that when we want to bring in a new curriculum, we must ask ourselves, how prepared are we? Not only in terms of our skills, but also in terms of the preparation in the infrastructure. So most of the challenges in teaching and learning in our schools, the two schools particularly, is related to resource limitation. And so this calls us to ask ourselves, whatever it is or whatever programs we are starting, do we think that we have enough resources that will help us to make those programs to be robust? So I think it's a conversation that was exciting as per the conversation we were having. And we thought that even though that this conference cannot be able to provide solutions to, for example, resources, but we can suggest way forwards that can be helpful, so that as we come up with the new programs, we are able to have done a good situational analysis that will tell us, or will inform us about the kind of resources that we need to bring up such related programs. Also, from this feedback, we can then deduce that there's no problem. The students thought that there's no gap in terms of pedagogy. Like they thought we are very good in terms of teaching and the way we transfer our knowledge to them. And this, I think in the morning when Professor Ashton was talking, she was asking us about how many times do we engage ourselves, for example, in medical education researches, and it was clear across the room that many of us have not undertaken this kind of resource, of research rather. Then what kind of evidence are we bringing forward for teaching our students to help them to emerge as the best students in the job market? Because I think that's important. It's not important to just have curriculum, because right now I think we've been taught enough about curriculum and the process of development, the process of review. But what about the most important conversation is how prepared are you to be able to execute those good documents so that you realize the good outcomes that you desire. So as per this, we were coming up with certain challenges which we thought are actually challenges to us in the process of execution or implementation of curriculum for the undergraduate students. For example, one of them was about resource limitation. And that is true from the feedback that we received on the graduates for last year. For example, you can see that the lab spaces are a problem. The equipment in the labs, we don't have enough simulation labs in the university. We have inadequate feedback on previous curriculum performance because, as you can see, and we should consider that the feedback from the students may not be sufficient. What about for the people who are implementing that curriculum, like the educators? Do we have a forum where our educators can give feedback on the feel of the curriculum, things that they would want to be adjusted or to be improved so that they are able to deliver the curriculum in a better way? And so going forward, we were thinking in our conversation that maybe this conference should then assist us to see how best we can move forward, especially on the issues of including also feedback from the faculty. And then, based on most of us are coming from the medical field, and most of us are not really educators, but most of us are like doctors who specialize in an area, or nurses who also specialize in other areas. But the nurses are advantaged in the sense that at least they have some sort of education in their curriculum. But now the other specializations, they do not have that kind of, the advantage that these nurses have. And so, do we feel qualified enough to be able to give the best in terms of the transfer of the knowledge that we have? I know we have the technical skills, but then how do we transmit this skill to our learners so that we are able to get the best? And then, again, in the field of medical education, we have very limited research, and it's time that we should ask ourselves, what can we do? And maybe this become by first training us on approaches of doing research, like the kind of insight that we got from Professor Ashton in the morning, and then maybe some kind of guidance so that we are able to do better, maybe work in partnerships with other universities that are already considering such things, so that we are able to bring, evidence-based practice that is peculiar to our students. Because what might work in another setup is not necessarily what will work in our setup. And then, of course, we are saying, even though we have a simulation lab that is at the Jaramogi Oginga Odinga Teaching and Referral Hospital, this may not be adequate to handle all the students in the School of Health Sciences. And so how can we sort of make the...
I can just try one more time.
Try one more time.
They might not hear you in the back.
It won't.
Yeah, so it will be important to know how, because in certain setup, maybe the simulation labs may work with very limited, even though we don't have a fully equipped one. What are other ways of doing simulation, especially in resource shortage area, like in our current situation? That's our university. So I think I've been talking about some of the way forwards as I was talking. As I told you, this was a very short, just to excite a conversation now that we are moving to a plenary, to also see what is working for us at Maseno, and so we can build on what is good so that we are able to improve. So one of the things that usually is a problem as we do the process of curriculum, review, development, and what have you, we usually have resource shortage. And most of the time you find that the schools are not able to do, let me say, like effective stakeholders meetings, and that's because of resource limitations. So we were suggesting that one of the way forwards would then be to foster partnerships with organizations that may help us to fund particularly such things like the stakeholders meeting and such like, and then we learn how to write grants, especially related to medical education, that will help us to support the curriculum review and development related activities. So just not to depend on others, it's also important to know how we can do our own grants so that we can attract funding for doing our curriculum processes at the university, especially at the schools of health sciences. And then today we got very good presentations from the experts in the field who are invited here today, and they've given us some insights, some good information about how we can review the curriculum and the processes which are involved. So one of the things is to train, and this forum I think has been meaningful, to train the curriculum review committee members on what to do when they are reviewing the curriculums or when they are developing curriculums for new courses. And then importantly is also to see how our potential employees, those are now the students, how are they able to fit in the job market. So it's important, for example, to get more, just other than the feedback that they're giving us in terms of curriculum performance, maybe at the end of an exam or when they're exiting the university, but when they're going out to the potential job market, like when they're going for programs like electives, how do the confidential reports look like? Are they all comprehensive, that we have some sort of surveys that can help our employers to also give us an insight on the expectations, so that we are able to do sort of the student-employer fitting, so that we can do some sort of matching, so that when our students go to the job market, then they can easily be absorbed. And then we were also thinking that more medical education-related research would be important as we are moving forward. And we could start with low-lying fruits, for example, just looking at the studies which have been done around this area on medical education, and doing some sort of either systematic reviews or scoping reviews to collect the information that we have and the current evidence on medical education, even as we try to intentionally do such kind of surveys for our students and also for our educators. Like, we can use our students as perfect examples of, executing like some randomized controlled trials to just compare, for example, like the blended learning. If students are being taught using blended learning and then purely faced with another type of, teaching, then how do they compare in terms of the student outcomes? Like the effectiveness of the teaching, would it then be evident that maybe blended learning is more effective in our population as compared to the alternative method of content delivery? And we were also saying that faculty feedback is very important, and because the university does not have, I think they've not done an intentional survey to actually get what the executor of the curriculum thinks, other than focusing more, it's more biased on the student. And even so, so the faculty are very important because they're the ones who actually execute this curriculum. So they would then help us with some constructive feedback that can help us to know how to improve. I think I've talked about the confidential reports and the potential that they have, especially when our students are exposed to the job market, because the students go for electives in areas which they like, and these are the potential employers. Then how can we ensure that our curriculum is responsive enough to the employer market? And then lastly, also just training the health professionals more on the current trends in medical education and with more emphasis on pedagogy, because we would appreciate that most of us are not from the background of education. And I think, this is the presentation that we had, and I thank you for listening to me.